Mr. Chairman.
First was Delegate Morgan, and then we'll.
Mr. Chairman, I can't remember the last mandate I voted for. And I share the concerns everyone else has, but you in essence summed up what I think I believe about this. This is a very narrowly drawn. It'll cover not really enough people, but it'll be an experiment that we can do. And I think without being inordinately expensive to any of the people who pay the premium. So for the same reason, I'm going to support that.
Delegate Byron.
Thank you, Mr. Chairman. Just speaking to the bill, I certainly know this has been a very tough issue for all of us, and a heartfelt one. I have an autistic nephew, and I have watched over the years the efforts that my sister has put into ensuring that he gets the different treatments he's needed, and he is she's been a great mom and has made sure that that happened. And he's 30 years old now, and he's doing well. The thing that concerns me, though, is that I'd like to see some uniform policy that is going to help all the children at some point, and we're going about this and coming down on health insurance, which we're all trying to find access to, and we have testimony that says that some school districts are paying for some of the treatment, and we have Famous that is already providing some of the treatment. We have the self-insured that are making that own decision on their own, and you have state employees, which our policy has mandated that when we put a mandate out, that'll be a mandate on the state health plan as well. Medicaid is providing some of these. We've also heard testimony that there's going to be a tremendous savings, and I have too many notes written down to find exactly what that statement was, in the special education monies that we will be saving on. And we've talked about the education side of it. I don't know what will then happen if we don't have some kind of uniform policy to the funding that comes through the education. And then we'll start having duplication, and there's going to be pockets of people that are not going to be able to have services provided to them. There's going to be people that don't understand why they don't have it, and others that will not be able to provide it because they can't afford it. And I think we'll lose the fight that needs to be out there to ensure that all the children have some treatment available to them. And I just believe that this is not the right area to get that. And I will continue to look forward to ways that we could find a means to ensure that the children get what they need. But I just don't see it on the health insurance plan.
Thank you, Mr. Chairman. For those in the audience, I'm not Delegate Russ, like it says here. I'm a member of NFIB. I'm a member of the chamber. After this, I'll probably get excommunicated. But I served on a mandated insurance commission last year that voted this bill out. And I did a lot of research, and I did a lot of homework, and I talked to a lot of people. And I was convinced in my own mind that this was the right thing to do. Now, in light of that, we had some limitations, and I felt like this time we needed some limitations. So I don't know if it was my suggestion or not, but I said I could support a 2 to 6 limit. I could support a cap. That way, I know that autism people are probably not all that happy. The business people are not all that happy, and that's a true compromise. Nobody's happy. And, but I can tell you that we are dealing, and just to echo Kathy's remarks, we are dealing with a flawed system with mandates in the Commonwealth of Virginia. We already have mandates, and they're there. And I sort of made a commitment that if I heard the word mandate anymore, I wasn't going to do it. But in this situation, I'd be going against what I did before if I did any other way, because I firmly believe that this is the right thing to do. But the problem is we're taking a lot of money here and funneling it down to a pendulum. It's like laying on a bed of nails. We can all lay on a bed of nails, but it'd be hard to lay on one nail, wouldn't it? And exactly what we're doing, we're laying on one nail when we do this, but we do that with all the mandates because they're not covered this, we're not covered this. I own a small business. I have 15 employees. When I went back home 2 weeks ago on Friday afternoon, I get in the office at 4 o'clock. My insurance guy calls me, he says, by the way, I got your renewal for your health insurance. Premium went up 40%. It went up 20% last year. That's 60%. Now, did the mandates cause that? Somewhat, not all of it. Some of it's the age, I'm getting old and everything else. The point is that businesses can't afford all of this cram down. So I felt like it was a good compromise to come up with a bill that would limit the time, limit the amount, see if it can, what effect it would have, and press forward. So I just want you to know where I'm coming from, and I support the bill. Thank you, Mr. Chairman.
Delegate Nixon.
All right, thank you, Mr. Chairman. I want to make just a couple of quick comments, and I don't want to feel like I'm repeating myself too much, but I mean, I'll applaud Delegate O'Bannon and the proponents. I think House Bill 303, even though I always have been, I hope I always will continue to be concerned about mandates, this is a much more reasonable approach than what we had last year. However, you know, we had a little bit of discussion about a bill that the General Assembly approved last year, which I like to call the walk, talk the talk bill, which basically said that with regard to insurance mandates, that if you're going to pass them, they should also apply to the state workforce. And one of the reasons that most of them didn't is because legislators were more than happy to impose a mandate on private business, but not on themselves. And so unfortunately, I don't know if this is the first, but I guess one of the very first mandate bills of this session, we have an exemption to take that requirement out. And we know that the reason it's taken out is because we know there's actual dollars and cents involved. And I don't want to narrow the debate down to just one of dollars and cents, because I know that there are human lives involved, and I do not want to in any way say that that's an appropriate comparison. But what it does say to us about legislators is that I think it's very troublesome to me at any rate that we would be willing to pass a bill that would force a business to do something, particularly during these times, that we're not willing to do to ourselves. So, Mr. Chairman, I hope that we won't support the motion before.
All right, there is a motion before us to recommend reporting House Bill 303 in the substitute form. All those in favor of that motion will answer the call of the clerk. That's what we're going to do. We're going to have the call of the clerk.
Delegate Morgan? Aye. Delegate Byron?
No.
Delegate Nixon? No. Delegate Jazz?
Pass.
Delegate Merrick?
Aye.
Delegate Joanna?
No.
Delegate Tyler?
Aye.
That's okay, sorry. It might help if I do this. Yeah, stop it.
Aye.
I'm sorry, Delegate Lewis? No. No.
Is there anyone else who has not been called? It's 4-4. Delegate Chance.
I'm not going to vote yes, I'm not going to vote no.
Abstain? All right. The motion fails on a 4-4 tie.
I want to thank the committee. I do want to tell you that this probably isn't going to go away. Thank you.
Thank you, Delegate. Delegate Janice. Delegate Albo was here. Is Delegate Albo still?